So who's our guest today, Dr. Parker?
Our guest today is Dr. Lisa Renzi Hammond. She's the Leonard W. Poon Professor of Innovation in Public Health and Aging and Director of the Institute of Gerontology and founding co-director of the Care Center at the University of Georgia. She is a public health educator, leader, and expert in cognitive aging and the early detection and assessment, if you will, of communication disorders. She has work that expands all kinds of areas in which the body works and doesn't work, and she is very much a principal in helping develop what Georgia has as a statewide plan for dementia prevention and assessment. At this time, I'd like to give the screen over to Dr. Renzi Hammond. Dr. Renzi Hammond, thank you for joining us here on BrainTalk Live.
So I am so happy to be with all of you. Folks who are watching in, give me 20 seconds to make sure that I can get us set up and get all of the things that we want you to see on the screen. So I am so happy to be here with you today. And I have enjoyed sharing many a stage with Dr. Parker and my friends at Emory. So this is an absolute joy to be here. So we're going to talk about cognitive vitality today. And you just engaged in a major thing that is going to promote your own cognitive vitality, right? So we're kind of working on the prevention side today, but I'll give you a little bit more information about sort of how we are in Georgia, what we're doing to prevent, and what you all can be doing to keep your own brains healthy, whether you are caregiving today, whether you are simply interested in brains and brain health, whether you are in early stages of living with a neurodegenerative disease, this information is for you. So I'm going to tell those of you, I see some of you are chiming in from out of state. So let's kind of get all on the same page with what's happening in Georgia. And the reason I want to use Georgia as an example is not just because I'm talking to you from Georgia, but because in Georgia, I think what is happening here is happening in a lot of other places. And you might be dealing with some of these things where you live, especially if you're not coming to us from a metro area. So Georgia is vast. We have 159 counties in our state. 118 or so of them are rural. And if I saw that some of you are identifying the city that you're from, I see Brookhaven, for example. I see some of you are identifying a place more like a county. And in Georgia, especially out in our rural areas, we really tend to be kind of county people. So about 70% of our state is actually rural. And Georgia is number 7 in the US for the number of people living with Alzheimer's disease or related dementia. We actually do have counties, multiple counties, including one in our top 10 nationally. So that's down in the southern part of our state. We actually do have one county out of thousands that's actually up there in the top 10 for amount of Alzheimer's disease presence. And if you are logging in as a care partner today, you understand what I'm saying. Georgia is second in the United States for the average number of hours spent caregiving. So Alzheimer's disease is kind of a big deal in Georgia. We go through a lot of it. Georgia is currently ranked 50th in healthcare for older people. It is a heavy Medicare spend, a heavy Medicaid spend for us. Alzheimer's disease here is one of those things that we see a lot in hospital visits. And our caregivers are working very hard, often at personal cost to themselves. So at the University of Georgia, we are fabulous partners and friends with the folks here at our Goizueta ADRC and our Georgia Memory Net program. Our state has really kind of gathered together to tackle this as a team and make sure that we are, we're together, we're supporting each other, and we are working together to deal with Alzheimer's disease and make it better. So today's presentation is not just about what to do if you have Alzheimer's disease. Really, it's about preventing. It's about cognitive vitality, growing your healthiest brain throughout your entire lifespan. And if you are joining us and you're above 65 and you thought to yourself, this is probably not one of those things that I should be worrying about changing my brain, that's absolutely not true. If you hear even one thing in the next few minutes that you have never heard before in your life, then your brain is starting to change immediately around it. In fact, if I could zap through your screen with imaging equipment that was sensitive enough, I hope you have a very different brain leaving this presentation than the one that you actually started with. Within half a second after learning something new, your brain is changing. I know you've got blood flow into your brains just like I do. These are all great preventive steps. So prevention actually starts before older age. If you look in Georgia, about 12% of Georgians over age 45 say that they're starting to experience some cognitive impairment. Our research out in rural communities would show that this next figure is actually much higher. So in our metro areas, about 60% of Georgians who've experienced a little bit of cognitive change have not spoken with a doctor about it. But out in the rural communities where the University of Georgia tends to work predominantly, it's more like 90% of folks who experience some form of cognitive impairment never actually go speak to a doctor about it. So those of you who are here, you're tuned in, you're working with the ADRC, you're engaging in research, learning new things, you're actually in the minority of folks who are out there tackling these problems. So when it comes to risk for Alzheimer's disease, I think a lot of people are surprised to learn that genetics are not always the answer, right? So there are definitely some risk factors that are outside of our control. Family history, right? We can't help what's on our families. Our age is outside of our control, although some of us, I've got my handy aging. Everybody is doing it from the Athens Community Council on Aging mug in my hand. Some of us are a little bit less terrified of embracing our ages. But then, of course, there's also genetics, and I say mostly outside of our control because some of the things that you do actually also express how your genes affect how they express themselves. But generally speaking, you've got the family, you've got the history, you've got the age you've got. So these aren't things that we change very easily. But there are a whole bunch of things that we actually can control. So these are what we call modifiable risk factors. We can modify them, we can change them. When we control these risk factors, we can really reduce our risk for a lot of diseases that cause dementias and those dementias themselves. In fact, when we start talking about prevention, I think a lot of folks might be surprised to know that our current estimates are about half, that we can reduce our risk by half just by engaging in the sorts of behaviors that you see here. And that includes managing medications, eating a healthy diet, learning new things like you're doing today, working on your cardiovascular health and exercising like you just did, right? Not smoking, controlling weight, managing your stress, and getting a good night of sleep, among a few others, like taking good care of your sense of sight, your sense of hearing. So what we're going to focus on for our next few minutes together is the modifiable risk factor that I think sort of gets sort of the most hype, but the least real attention, and that is the things that we put into our body. You see, dementias can potentially be delayed, slowed, maybe even prevented by addressing those modifiable risk factors. But if we're going to pick one, right, to take a look at, if you were to get on your computers right now, don't do it later. But if you were to do it right now and just ask a simple question into your browser, right? Go to Google and say, is red wine good for you? Or is chocolate good for you? Or are eggs good for you? You're going to find so much conflicting evidence that it becomes really, really hard to sort through. So what we're going to spend our next few minutes doing is sort of cutting through some of the noise for a little primer on diet and nutrition for brain health. And then an invitation to continue contributing to knowledge, but that the ADRC, through those fabulous messages that you just found in your chat, and through some other programs that are happening around the state. So let's dig in just a little bit more. So first of all, when it comes to diet, I think for some people, diet is one of those words that causes you some fear, right? If you've got a bad experience with, quote, dieting in the past, when you hear the word diet, you think, well, that's terrible. But simply put, your diet is just all the food, drinks, and stuff that you put into your body. It's it. That's it. It doesn't mean the South Beach diet or the ketogenic diet or a specific way of eating. Your diet is just all the stuff that you consume. Now, nutrition is sort of the use of that stuff. So it's breaking down food and all the nourishment that comes in and actually using it to do work in your body. So diet is the vehicle for getting nutrition into your body. Now, when it comes to eating healthily, it's really important to know, and these are stories, we've done these studies at the University of Georgia, they've been done by other institutions in the state, that diet can really significantly impact how well you think. The way to think about it, right, is that brains are made of nutrition. Your whole body is. So the stuff that you're taking in really can change the structures inside your body and how well those structures function. So I'm going to take a hot minute and sort of remind us all of what a food actually is, because I think that we're a little confused as a society right now. So you see that beautiful shiny apple on your left. I've done research for years on what people take into their bodies and how they affect their brains. And when I ask folks what foods they eat, they very often rush to tell me about all of the nutritional supplements they're taking. And they're actually not the same thing. I'll make that point to you in just a few minutes. But I also want to make another point that the other stuff you're seeing on your screen right now, that's also not really a food either, right? So a food is if I were to take this apple, the primary ingredient in apple is apple because it doesn't have ingredients, right? The food is the thing. Apple is apple. But if you take a look at the stuff that's on, the right side of your screen right now, when in our history have we ever had to call something organic? What else would it have been? Right? We now use words like natural that don't have a whole lot of meaning because it makes us feel better when we eat those foods. Chicken doesn't come in dinosaur shapes. If you see perishable things that say no need to refrigerate, it's because there's some sort of chemical in there that's making them not need to, that makes them shelf stable. We have to say that our juices are 100%, otherwise they won't be. We like instant things. And if you take a look on the lower right hand of your corner of that collage, whatever that is, I assure you that it is not fruit. So to make that point about sort of what is a food and what isn't a food, it's funny, we sort of identify certain foods with certain things. So if I were to say to you, my wonderful friends online, it is cold and flu season. You should probably take some more vitamin C in your diet. What foods, you can type it into your chat, would you recommend? Vitamin C. What foods would you tell me have lots of vitamin C? I see Stan was right on the money, right? So many of you, oranges, citrus foods, exactly. No one so far has said an apple, right? Those citrus foods that you just typed in, right? You really think of being as delivery vehicles for vitamin C. So there was an amazing study that came out just a little while ago where they actually gave people two things, two choices. They gave people either an apple to eat, and an apple doesn't have a whole lot of vitamin C. That's only 6 milligrams. And they checked blood and they sort of took a look to see, what's going on in blood. How long does it, how much vitamin C do you get in your blood after just eating an apple? Then they took a second group and said, we're going to give you vitamin C supplements until you have as much vitamin C in your blood as the people who ate the apple. And it took 1,500 milligrams of vitamin C to get the same blood response in the supplementers that it did the folks who just ate the apple. And that is because that is all the stuff that's in a whole clean apple. And I promise you, I didn't hide any words in there. Those are all bioactive phytochemicals inside of an apple that help you get all that great nutrition into your body in a way that you can use it. So, absolutely staggering stuff, right? So let's take a few minutes and talk about what we are eating. So one of my favorite ways to demonstrate what we eat in the world was a book by Peter Menzel called Hungry Planet, right? It's What the World Eats. It's basically a food atlas. So when you take a look at this picture, this was a typical family from North Carolina. This was pre-inflation pricing food for 1 week. And if you were to identify the food as I defined it earlier, I promise you this is not an eye test. There is a little bit of it on the screen, and it's right kind of here in the center. You can see the grapes and the tomatoes almost right in the center of that picture. But the rest of it, all of this other stuff that you're seeing doesn't meet the definition that we made for food at all. So American diets, about 65% of what we take into our bodies is processed, right? It doesn't meet that definition, our strict BrainTalk Live definition of what a food is. So if you look across countries all over the world and you try to ask the question, what's the impact on our bodies of eating those standard American diets? The answer is it's not great. If people were just to eat a healthier diet in general, we would prevent 11 million deaths every year. We would also gain back about 255 million disability-adjusted life years. Those are those years that you spend in your optimal state of health, right? So Americans are living longer and longer, but we spend about the last 12 years of our lives sicker and sicker, right? So that's 255 million really healthy life years. Now, if we just cut down on our salt, we'd prevent about 3 million deaths every year and gain back 70 million disability-adjusted life years. If we ate complex carbohydrates instead of simple sugars, we would gain back, another 82 million disability-adjusted life years and prevent 3 million deaths. And if we just ate more fruits and veggies, right, we would prevent about an additional 2 million deaths a year and gain back another 65 million disability-adjusted life years. So I'm seeing some wonderful questions that I'll go ahead and tackle a few of them right now because they're wonderfully applicable. So we have a question about meats. And the answer is that the data on meats would so far suggest that those lean meats are pretty darn good for you. How you cook your meat matters, right? So high heat charring is probably less healthy for you than, some of those lower temperature cooking methods. That fish and things like that are also wonderful. In fact, I'll show you a little fish slide in just a minute. But generally, if you are going to, when you think about your diet, being a little heavier on the plants and lighter on the meats is generally a pretty good idea. Now, some of you are also asking about pesticides. I'm going to hold that one just for a minute because we're going to go through some sort of common sense food advice really in just a few minutes that will help you think a little bit differently about how you're picking food and the sorts of things that you're really focusing on when you're making those food choices. So to show you sort of where we are in the world, I've got high income North America sort of outlined here in the red box. On each of these panels, each of these different sets of colored bars is a different food group. So we have fruits on the left. The next panel is vegetables, legumes, whole grains, and seeds and nuts. The little green shading here at the edge is where we want to be. And then, of course, this bar, right, shows where we are. So if you look at fruits, you can see we're pretty far short of touching that green bar. Same with vegetables. We're pretty short of touching that green bar. Same with legumes and whole grains. We're way far off. And the same with seeds and nuts. So we're not getting there, right? We're not meeting those sorts of dietary guidelines. But I also want to make the point to you that it's not just what we're building our brains out of. What we choose to eat also impacts a whole bunch of other things that we do. So there's a wonderful set of studies looking at the Western diet, right? The things that we're eating right now the sort of unfortunate inverse food pyramid that you see right here on the left. People who consume those diets, in addition to having all the heart problems and the things that you know about, are also more likely to have other kinds of behaviors that are nothing like what John Lewis just inspired us to do, right? So those unhealthy foods tend to be related to changes in epigenetic changes in DNA. So we start expressing genes for things that we don't really want to express. We tend to spend more time watching TV and doing sedentary things. We're more likely to smoke. We're more likely to use lots of medications. We're more likely to drink and feel high levels of stress. So Behavior, we sort of compartmentalize our behaviors, don't we? So we talk about exercise on one side, or eating over here, or avoiding stress over here, or learning new things over here, without remembering that all of these things are really connected. When we're eating healthy foods, for example, we kind of feel good and we feel motivated to get up and move our bodies. Going to dinner, a really nice, healthy meal with somebody is a great way to enjoy companionship and to spend time. When it comes to our brains, your brain needs all of those nutrients that you're getting through a healthy diet. Your brain, for example, if you siphon off all the water, 60% of what's left is fat. But there are some really significant differences, right? Between the sort of, the sort of butters and the sort of solid fats versus oils versus things like healthy fish. So if we look at our fat source and we're looking at, say, oily fish like salmon as the source of that fat, those folks who are eating those, this was a study done with about 135,000 people surveyed. Those folks who eat that nice source of fishy fat more than once a week experience about a 20% reduction in risk for Alzheimer's disease. So it's really important to make sure that we're eating really well. So what does that look like? Now I'm going to get into that more pragmatic question about what you can eat. For example, are apples safe to eat? And the answer is that generally speaking, we want you thinking about healthy diet patterns, right? I too had a love affair, a little on the torrid side, with my pumpkin pie over this Thanksgiving break. I am a pie baker. I'm also a bread baker. So I feel every bit of that. I make a killer chocolate pie and it happened and I enjoyed it. Right? So it's not the case that you can never have treat foods or do things like that. What you're really looking for are more sort of pure foods, less processing. If it's a food and you recognize it as a food, that's probably a decent choice to make. So for example, when it comes to diets, one of the diets that we talk to folks a lot about is called the MIND diet, because it's one of those things that seems to be pretty darn good at helping us prevent neurodegenerative disease. So it's MIND, it stands for Mediterranean dash, right? So the Mediterranean diet, you see elements of that. You eat like you're one of my folks from ancestral Italy, right? So you see the sort of Mediterranean piece. DASH is the dietary approaches for stopping hypertension. And then it's an intervention specifically for neurodegenerative delay. And that means eat your greens. Eat lots of green leafy veggies and berries and nuts and whole grains and fish and food that looks like food. On the other side, eating less of fried food and pastries and butter and red meats and things like that. Note that it doesn't say no meat. It says that, we're going away from the sort of red meats that tend to be a little bit less healthy. So I'm going to pause here for a minute because I want to come back to that question about pesticides. It's really easy for us, I think, to sort of get caught in the sound bites about there's arsenic in dark chocolate, or there's, pesticides on fruits, or there's things like that happen. If you take a look at most of the sort of diet related problems in the US, it's not, oh no, I've eaten an apple that was improperly washed and had some pesticide. It's more, I don't eat apples at all. Right? So it's, thinking about the foods that we eat, think of it almost in a stepwise way. Step one, if it's a fruit or a vegetable, eat it. Step two, you can haggle over its purity and its source and those sorts of things. Generally speaking, fresh produce is wonderful. Frozen produce can be extraordinary too. And one reason that frozen produce can be quite great is that it's frozen right at the moment of peak ripeness. So fresh produce, like right now, is not strawberry season in the United States, but you can still go buy strawberries. To make them nice and red by the time they get to you, they're picked and separated from the dirt, right, their nutrition source, before they're actually ready to be separated to get to you. So in that case, a frozen strawberry might actually have a little bit more nutrition than a fresh one would. So frozen substitutions are really great. They also keep food fresh for longer. Try to avoid canned if you can, just because there tends to be added salt and things like that in canned goods that's a little less helpful for you. So fresh and frozen produce, wonderful. I would still prefer that people eat canned vegetables as opposed to not eating any vegetables at all, right? You can do things like rinse the vegetable in there and get a lot of that salt off. So definitely care about where your food comes from, care how it's treated, right? Wash it, do things like that. But the bigger problem that we face in the United States, regardless of where you live, is that folks aren't eating those foods in the first place. And sometimes we use those little sound bites as excuses to talk ourselves out of eating a healthy food, right? We might see the apple and say, oh no, there's pesticides on that, I don't want to eat it. And then switch to something that's much less healthy, right, than an apple would ever be. So let's talk about how to get there, because people often get diet advice and they say, all right, I'm in it, I'm ready, I'm going to change my diet and do all the things. They change everything radically and then go, nothing tastes good. I don't like this, right? This is very, very common for us when we do things like switch somebody to a DASH diet to lower sodium. So one great way to do things in the beginning when you're working up to building new dietary patterns is to remember that forming a new habit takes a lot of time, right? If you've eaten a certain way for years and years and years, you can't expect yourself overnight to be like, no, that kale tastes amazing and I love it. Thank you. I always dreamed of kale, right? It doesn't quite work that way. Taste isn't just a matter of your tongue. It also lives in your brain, right? And in your nose. It takes us sometimes multiple exposures to a food to make ourselves like it. I'll give you a great example. I'm not a beet fan. I was never a beet fan. I didn't like them, but I know beets are really good for you. So I thought, all right, these are good. I'm going to make myself like them. And so I would try just one little bit. My husband would get a salad and I'd be like, I would like one beet out of your salad. Just one, only one, right? And then the next meal I would try it again and try it again and try it again until I didn't hate them. And then over time, you start to develop a taste for things that you never thought you'd like in the first place. One key to doing that is just small swaps, right? If you like sodas because you love that sort of pick-me-up tingle, the sparkling water is a really great swap for that. And you can even get flavored ones. Then you gradually back down off the flavoring until you just like the water, right? Instead of a regular canned vegetable, start with a low sodium till you get used to the taste of less salt. Then when you switch to frozen or fresh, you're more likely to like it because you're no longer so hooked on the salt, right? Instead of added sugar, full fat yogurts, right? Grab a low fat yogurt and add some fruit to it or some honey, right? It's really, really small substitutions that make a big difference in training your brain to like foods that you've never liked before. So diet is just one of those many things. If you are interested in learning more about brain health behaviors, you have the best resource in the world right here in BrainTalk Live. If you're looking for other videos, sound bites, tidbits, if you go to carecenter.uga.edu and click on the prevention button at the top of your screen, there's a brain health video series there that also covers learning new things, how learning radically new stuff is really good for your brain. It covers things like, why sleep is so good for you, right? Or why we should all be like John Lewis and move our bodies. So I want to point that out to you and point out one more thing before I take the other questions that I'm seeing here, such as, is Greek yogurt healthy? And the answer is sure. It's a really great food as part of a nice, healthy dietary pattern. Greek yogurt's just a food, right? Pretty simple, straightforward stuff. So one thing that we're doing is learning a little bit more about all of the ways in which people eat, the health behaviors that they engage in, the things that they can do to actually work to prevent Alzheimer's disease through keeping really healthy brains. So we're about to launch something called the Georgia Mind Project, and a huge thanks to our friends at Emory, who were kind enough to help write some letters of support to get this program off the ground. So MIND stands for Multidisciplinary Interventions for Neurodegenerative Disease. We're going to try to do as much good prevention work as we possibly can, and do a good job of reaching more and more folks in research. So as you can see, our fabulous friends at Emory have such a strong presence in so many counties. We're trying to kind of fill in some of those places, particularly down here in the South and in the eastern part of our state. where our Metro friends are kind of working with us in this sort of complementary strategies. So if anybody is interested in learning more about the Georgia Mind Project, we're aiming to enroll about 10,000 Georgians, and then to share all of this great information with our other research friends at places like Emory and Georgia State and Georgia Tech, those folks around. So if you're interested in learning more about it, all you have to do is email georgiamind@uga.edu, and we will keep you on the list and keep you updated about how things are going. So, magnificent Dr. Parker, I'm going to turn it back over to you, my friend.
That makes me feel almost important. So thank you so much, Dr. Hammond, for presenting for us today. You were so animated, so engaging, and we got lots and lots of questions. And I really appreciated the swaps, because I think that no matter how long you do this, the more you hear something sticks every once in a while. So my young people in this room, we've been trying to help make healthy swaps. Instead of eating Chick-fil-A all the time, we're trying to make better swaps. You know, our favorite thing is the waffle fries, but it's like, how can we do a little bit better? So your little chart about how we can make substitutions was great. And one of the questions in the chat is, what kind of olive oil? And just like all vegetable oils aren't the same, olive oil, should we do the extra virgin olive oil, just plain olive oil, the mixed avocado oil with olive oil? Which one is better? Almond oil. There are a whole bunch of gourmet oils at TJ Maxx and Marshall's for sure, but also at the grocery store. So help us understand what kind of oil to pick. Now we know you don't want peanut oil, which is used for frying fish and chicken. So let's talk about olive oils and vegetable oils. Is extra virgin olive oil better than avocado oil, better than almond oil? How should we make that?
Oh, this is food oils are one of, weirdly, I'm geeking out on food oils right now. There was actually even something that came out today about cooking oil and risk for obesity and other things. So the difference between, say, an extra virgin olive oil and a different type. So an extra virgin olive oil is cold pressed. There's no chemicals. There's nothing in there. It's a little bit more acidic, but it's one of those things that's really good for low heat cooking. So the problem with olive oils is not that, is you can dip things into them. They're really, really great. The sort of where you get into trouble with olive oil is really when you try to cook it too high. If you see it starting to smoke, you've passed its smoke point, and you'd want a different oil for a higher temperature cooking. That's a great time to use, say, avocado oil or coconut oil, which can take higher heats. Virgin olive oil is a little bit different. It's cold pressed, but it's a little bit more processed. So there's a little bit of additive in there to extract the oil, and then refined olive oil is chemically extracted. The oil is extracted from the olive via a chemical mechanism. So I always pick extra virgin, but I try to restrict my use of olive oil to cooking at 350 to 400 degrees or less. So if you've got your broiler on, olive oil is not the oil for you.
Okay, so let me make sure that I understood what you said. Extra virgin olive oil means that it's just been cold pressed, right? There's nothing been added. They've just smashed the vegetable to death, and you oiled it, degreased it, oiled it, whatever. You've just smashed the heck out of it, okay?
That's right.
If we have a refined olive oil, that's been chemically processed. So we want cold pressed oil, right?
That's the name of the game. Absolutely.
Okay, everybody, you got it. Cold pressed oil. See, I didn't even know that. I just knew that you're supposed to do the extra virgin olive oil because that's what's on all the cooking shows. Okay, all right. That was a big deal. That was a big deal. And the other thing that you mentioned was higher temperatures. If you're cooking at higher temperatures, I think sauteing in a pan isn't necessarily super high temperature. So if you want to saute some spinach or some green leaves, you can use olive oil. But if you're trying to braise a meat like a fish or a beef or a chicken, you don't want olive oil. You may want like almond oil or coconut oil. Is that right?
That's right. Or I'm a big fan of avocado oil. Grapeseed's another one. Grapeseed can go up to about 420. So it's not.
Thank you, Miss McGee. Grapeseed oil. I didn't know. So,
Yeah.
okay, everybody, we're clear on that part, right? Okay, so here's a question, and this is a good one because when I've heard these nutrition conferences before, I grew up with the Good Season seasoning pack where my mother put the olive oil and the vinegar and the seasoning together. And I'm going to just say this out loud because this is my bias. Bottle dressings aren't good for you because there are lots of preservatives in them. So if your mother and your grandmother made salad dressings and mixed the olive oil and the vinegar together, that's better for you. But somebody in there, where is the question? I'm trying to find it. Somebody find that question for me. Switching from bottled salad dressing to olive oil and balsamic vinegar elevated my good cholesterol levels. Thank you, Mrs. Williams. That's an important thing. Balsamic vinegar versus cider vinegar versus white vinegar. Which one should we use? That's a very basic one.
They're all actually really fine. In fact, there's a variety of vinegars that you can try if you're feeling adventurous, right? Including different types of wine vinegars that are actually all quite good for you. Vinegars in general are a pretty good solution. And you're so right. It's actually pretty easy to make salad dressing at home, and then you can mess with it and make it perfect, and you know everything that's in there. And all it really takes is olive oil, whatever your favorite vinegar is. I've been going with like a white champagne grape vinegar these days. And then whatever seasonings you kind of like, smash up a garlic clove, and all you really need is a shaker, and shake it up, and you've got good salad dressing in your fridge for a little while, and you don't have to get any of the stuff with the preservatives.
And you'll save a lot of money doing that.
Absolutely.
And another kind of acid instead of vinegar is lime juice or lemon juice. We forget that we can use lime juice and lemon juice as our vinegar. And when you make a kale salad, you should wilt your vegetables, massage your greens with the olive oil, and then sprinkle lots of lemon juice on it. You hear that, Bennett and Ian? Okay. All right. I'm loving this. Okay, let's see. There's a question in here about the BAPAs, the things that are in plastic. Can you comment on that a little bit? I mean, those are ubiquitous. They're absolutely everywhere. I don't know how we can get away from that.
So we have just done a project. It's at the other end of the lifespan. So this one's on brains that are developing earlier in life, looking at the sort of forever chemicals, right? PFAS and those sorts of chemicals. There's BPAs, those sorts of stuff out there that are not really not great for you. And you're right. We're sort of almost going back to the arsenic and the apple question, which I'm going to carry with me for a while, because I think that's the sort of, that question was so beautifully phrased, and it's exactly the sort of thing we hear often. And that is that there are really nasty chemicals out there, and if we eat natural products, right, that have been exposed to those chemicals, we could be in big trouble. And I think our data would agree with that we need to minimize those sorts of chemicals, that the food, that the bodies we have, the foods we put into them, and the earth outside that we're picking those foods from, right? They're all connected together. So definitely making sure that you're trying to avoid those chemicals where you can seems like a pretty darn good strategy. But that being said, very often we'll be like, oh no, there's a pesticide or there's something on that. I'm going to avoid it, but it also means now that I'm going to go do something that's less healthy than consuming the thing. You don't want to do that either. So there's a lot of things that you can do, washing produce really well. You can make your own home fruit and vegetable washes to remove certain types of chemicals. But to some degree, I think the sorts of forever chemicals and things like that are out in the world, they're here, right? And you'll drive yourself crazy if you try to get, filter your water. Like there are things that you can do that make a lot of sense, but this is the world that we're in, and unfortunately, I think a lot of those chemicals they're just here, and it's going to be real hard to undo that damage for a while.
So I see two questions in the chat, and I'd like to address them, but because you're at the University of Georgia, and when I lived in Walton County, which is a little bit more rural, we had the home extension service. And the home extension service provided a lot of nutritional tips and like where you could get things. So if we want to get fresh vegetables and we're a little bit more rurally based, you know, we have farm to table restaurants, but that's the way a lot of us grew up. So it's sort of like if you can pull it out the ground, wash it and put it on your plate, that's better than eating processed food. But there are questions in the chat about vegetarianism and being vegan, and I just want to put a plug in here for the home extension service and nutritional advice and services. Can you kind of help people with that?
I sure can. In fact, I'll stick a link in the chat. So one thing about the University of Georgia that makes us, you know, that makes us able to be great friends with folks all over the state. You know, so you're hearing this fantastic relationship between UGA and Emory right now. One of the tools that UGA uses to make sure that we're kind of doing our part. I love Walton County. It's real close to me. That we're doing our part, you know, in the rest of the state of Georgia, is our extension service. So the University of Georgia has an extension agent living and working in all 159 counties in Georgia, right? So UGA, if you look at universities in our state, right, Emory is exactly where I would go if I had a health question. I'd be like, hey, Monica, help me out, right? I mean, Emory is so known for its extraordinary medical services. Historically, UGA was known for its outreach and its agricultural services and things like that. So we all play very complementary roles. So UGA, as the land-grant university in the state, one of two land-grant universities in the state, actually has folks living and working in all of these counties, and nutrition and agriculture are the things they're trained on. So if you want to know where a local farmer's market is, or you've got some questions about how to prepare food or how to store it safely, or even, you know, where to get it at a discount, your local extension agent will help you out with that. So if you just click on that extension.uga.edu, whatever county you're in the state, there is a UGA extension faculty member who lives there who will be able to help you out. And it's a really, really great service. One of the reasons that CARE is so active in our rural communities is our extension friends. And they allow us to take the great information that our ADRC is producing and take it out there into the world and make sure that it lives all over the state. In fact, I've recommended BrainTalk Live a fair few times myself.
Thank you. We appreciate that. We really do. So I think we're getting to the point where we're coming to a close. Thank you so much, Dr. Renzi Hammond.